In this segment, we're going to look at how we actually set up the machine with a patient and use it in a clinical way and make some adjustments. So we'll start with the monopolar electrosurgery, which is where we require a circuit from the machine through the patient and back to the machine. So to achieve this, we have to have, in contact with the patient, a patient plate. So the GEMA comes with this plate here. You'll see this has two sides, blue, black. Black is going to be in contact with the patient. There are other patient plates available, so some of them are metal on both sides, and that's fine. There are commonly used in human surgery self-adhesive disposable plates. I don't recommend those for our patients, because if you use them more than once, you will have a failure of electrical contact. And there is a large and expensive capacitance plate, which actually doesn't require electrical contact with the patient. But this is what's supplied with the machines, and this is what is the standard use. So this is going to be in contact with the patient. And the concept to get across is that the effect of electrosurgery is greatest when we have a smallest area of connection, and therefore the highest current density between the source and the tissue. And the effect of electrosurgery on the tissue is least when we have a large surface area and a lower current density. So at the patient plate, which is inactive, we want a large surface area in contact with the tissues to reduce the possibility of any injury to the tissues there. So we have to have an excellent electrical contact between the patient and the plate. What we should avoid is any gaps, of course, and what we want to achieve is a surface that is as conductive as possible. And what I recommend to you strongly is the use of a conducting fluid or conducting gel. Now this gel, and there are lots of other brands available, if you read the package closely, it describes it as conductive. So this is not a simple ultrasound gel, which is conductive only to ultrasound waves and not necessarily as conductive to electrical current. This gel I have chosen is electrically conductive. Now there are ultrasound gels, which is what many people use, that are also electrically conductive, and that's fine, but you should, wherever possible, choose to use a gel that is conductive, and this is quite important. This is the correct solution to use. So this is going to go on the patient plate. Don't hold back. Now people ask if you need to have the patient clipped, because obviously hair or fur is not conductive. It does seem possible to use this on a hairy part of the patient if you have sufficient conductive gel and if you have sufficient weight. So in other words, the plate underneath the patient and the weight of the patient onto the gel and therefore onto the plate to get as good contact as possible. So don't hold back with the amount of gel, and do try to choose a conductive gel, not simply a plain ultrasound gel that may not be conductive. I think I've said that several times now, so I think you probably understand. Other people will use saline or even a concentrated salt solution. So you, for example, could make your own concentrated salt solution. You could soak a swab in that, and you could place that wet swab between the patient plate and the patient, and that will be conductive. The main disadvantage of that is that the swab will dry, of course, during a surgical procedure, and then the conductance will reduce and the risk of patient injury through electrical burns increases. So a soaked swab is an alternative, but you must use a concentrated salt solution, and you should be aware that it may dry out during the procedure. What you must never use, but I have become aware of people using, is surgical spirit. Surgical spirit is not particularly conductive, and it is also flammable. And during electrosurgery, there will inevitably be some sparks and heat generated. So you should avoid the use of flammable substances. It seems perhaps obvious, but it's worth repeating. Spirit and other alcohol substances are flammable, and electrosurgery produces sparks, and this is not a good combination. Likewise, electrosurgery is not a good combination with exposed anesthetic gases. So you would not use electrosurgery around the head of the patient, for example, if you were using a mask inhalation technique as opposed to an intratracheal tube. This has happened. There have been so-called tracheal fires, for example, in theatres, and this is to be avoided. So we're going to use conducting gel. Typically it goes underneath the patient, and the weight of the patient will ensure the contact remains. Alternatively, you could place this on top of the patient. For example, I will sometimes place the plate over the groin, which is hairless, which is quite attractive, but then I will place a sandbag on top of the plate to hold it down. So here we have, for the purposes of our surgery today, our patient. Having put the patient on the gel on the plate, it's good to give it a move about to try and make sure the gel soaks through the hair, and we have as good contact as possible between the patient and the plate. So now we'll do some monopolar electrosurgery. So the instrument we use is typically the monopolar pencil. This is going to plug into the front of the machine here. Can only go in one way, which is good. I'm going to choose to start with the pure cutting mode, and I'm going to use the forced coagulation mode. So with the buttons on my monopolar pencil, I can choose yellow for cut, and this, because I've set the machine up, will be pure cut, or I can use blue for forced coagulation. This is the pencil that's been supplied with this machine. There are other pencils which do not have the buttons, and instead you activate them with a foot pedal, and again the controls are the same. Yellow for cut, blue for coagulation. This plugs in the back of the machine. The machines don't like it if you have this plugged in and you try to use the buttons. So if you have the buttons, you don't have the foot pedal plugged in because the buttons won't work. So we're ready to cut, and you'll remember when I activate the machine, it's going to produce a current from the machine to the tip of the pencil. The finer the contact between the pencil and the patient, the higher the current density and the more effective it will be. It goes through the tissue, hopefully dispersing through the tissue as it goes to the plate to reduce the biological effect. We want the highest biological effect at the tip, and then back to the machine. So when I activate it, it makes a buzzing noise, quite a quiet buzzing noise. I hope you can hear that. There's one noise for cut and another noise for coagulation. So we're going to start by cutting, and as with all cutting during surgery, we want to keep the tissue tense during cutting. So I will use my non-dominant hand. I will activate before I contact with the tissue because it cuts with a slight gap. In other words, if I touch the tissue and then activate, it has a different effect and not a very effective one. Whereas if I activate it before I come down to the tissue, you can see a nice cut there. So that was good. Whereas if I start by having the tissue, the probe in contact and then cut, it doesn't want to do anything. Or I'm dragging it. And you'll also see as I do that, there's a much wider area of collateral damage. So when we're cutting, we activate before we come into contact, and then we're keeping the tissue in tension. And you see there as I cut, there's no drag, there's no stickiness between the tip and the tissue, so that's an appropriate level of power. If we look at the edges here, there's a white to maybe slight brown change, so there's minimal tissue damage. If we have excessive power, so let's try that first. So turn the cutting up here to 70. We'll get more tissue change with the higher power. On the other hand, if we go down and we don't have enough power, there's a tendency to tissue drag. So we have to choose the right power, but remember this is only an indication of power. It depends on the composition of the tissue, so we'll have to adjust it each time. If there's more fat, then we need a higher level to achieve the same power. So that's cutting. One thing to note, during cutting you will tend to get some coagulum, some damaged tissue on the tip of the instrument, which over time will reduce the effectiveness because it acts as an insulator. So it's useful to wipe this regularly, for example with a damp swab, or you can buy a scratch pad, sterile scratch pads from your consumable supplier, which you can use to keep it clean. So that's cutting, and with the same instrument we can do coagulation. Again, you're going to have to adjust the power for the effect you achieve, and we can bring that down, and that will produce a point coagulation and therefore control bleeding. Or we can choose soft coagulation. Not enough power there. The problem with coagulation used like this is that you will get increasing amounts of debris on the tip. So another way to use coagulation is so-called conductive coagulation, and this is what I tend to do during surgery. Is I will have, for example, my Addson rat tooth forceps. I will pick up the bleeding point. I will apply some tension to it to reduce the area of contact, and then I will bring my blade against the instrument, and you can see that's with excessive power there, produce excessive coagulation, but it's a very efficient way of producing a point of coagulation and has the advantage that I'm not getting coagulum or detritus on the blade, so I don't have to clean the blade so often. So I think that summarizes monopolar electrosurgery, cutting, coagulation, the importance of patient contact, why we need to adjust the power settings, and I think the other thing to remember that I mentioned at the beginning, when we're using cutting, so for example if we're cutting the skin or the mucous membranes, we don't touch and activate, we activate, maintain tension, and then cut.